cloud and okay. And I'm going to do a screen share. Okay. And then let's see. Okay. Okay. Can everybody see everything okay?
Beautiful.
Yeah.
Yes.
Perfect. Okay. So we'll just use it like this. So welcome, you guys. Thank you so much for being here. As you know, my name is Brittany with Critically Aesthetic. I'm located in Douglasville, Georgia. And I kind of do, my top surfaces are lasers, microneedling, PRP, and like Botox. Those are my top services. I do offer like facials, skincare options for a lot of people. And so that's what I do. And so I'm gonna let Miss Abby with Esthetician University introduce herself.
Are you gonna throw me the ball? Okay.
Yeah.
Hi guys, how are you? Happy Wednesday, happy Women Empowerment Wednesday. Thank you guys all for being here. Brittany has so much great information to give to you guys. It's chemical peel season, as she said. If you guys, depending on what services you offer, chemical peel during the fall and winter is really big money making time for us because people are inside, they have money to spend, they're not bouncing around outside in the summer, going to this beach and that beach. Right. So guys, definitely, if this is something you're interested in, definitely tap into it. I'm not a big person on like huge packages. However, with chemical peels, I would definitely say do some packages because you kind of have to, because it's the best way to see the results. Anyway, so hi guys, my name is Abby Otley. I am the owner of a beauty studio and spa located in Peekskill, New York. I am the founder of Esthetician University. I'm not sure if you guys are, any of you guys on here know who I am, but I am an award-winning instructor last year for Spa Shop, and then this year I'm nominated for Best Leader. And then for 2023, I'm a pro wax judge for the Skin Games. So if you guys haven't signed up for Skin Games yet, let me know, because you still have time. And this is a great thing to enter into with the chemical peels because it's such great results. Thank you, Brittany. Thank you for this. Thank you for being here. Thank you for having me on your platform. Thank you for hosting this class.
Yes, I'm so
excited. And guys, congratulations to all of you who, took the steps to, going forward and doing this. But I do have one question before I turn it back over to Brittany. Is everyone in here right now either an esthetician or a nurse? You can just drop a yes or no in the comments. Okay, awesome.
Mm-hmm. I don't know what see the comments. Oh, I do see.
You can see the guys. Perfect.
Okay.
So, Carrie. Okay, Carrie is she's about to be an esthetician, or what's her background?
She is a prospective client.
Okay, awesome. Congratulations. The fact that you're even taking the step to take this class, it means so much to us as a provider, because we need to educate, our clients on the steps and the protocols, because sometimes people see chemical peels online and they're like, oh my God, I want that. But they don't understand, the process and how important it is. Like, that's why a lot of us don't offer peels in the summer, because people don't realize, what chemical peel can do to your skin, and they'll still go ahead and go to the beach. But anyway, thank you, Carrie. Awesome. You'll definitely get some great information.
Yeah, thank you for being here. So so let's get started. So why are you here? So I put together a couple videos. I know you guys seen some of these on the reel, but I'm gonna click on them so we can watch the actual, and this is what people see online. This is what people see on TikTok. So of course, I know you guys have seen this one. And And this girl, she had came to a facility here in Atlanta, Georgia, received a microdermabrasion, a dermaplane, and a chemical peel all in one session. And as you can tell, she has a lot of discoloration. It looks like a lot of burn. I would say about 1st-degree burns, but still, it's still on her face, places where she can't cover. And so that can be very intimidating for a lot of people. And then we have, oh Lord, I'm opening up other stuff. How I get back. And so, yeah, so that can be very, intimidating for a lot of people whenever they come into locations and they expecting a service, and then they walk out and they didn't get the service that they were expecting, that they had seen online or etc., because of the fact that they weren't educated enough, or the provider, was too aggressive with the treatment, I will say. So let me just, I don't know where that went, y'all. So, oh, it's here. There we go. And it is here. Okay, here we go. And so, so that was that one. And then we have the guy who also had an esthetician here in Atlanta. And I believe he only went in for the chemical peel. And he ended up in the ER with 2nd-degree burns. However, now his skin looks a lot better. I should have just put an update of his process, but his skin looks a lot better. But these are things that can happen to clients. And it's not only happening to the client, it's also happening to the professional at the same time, because the worst thing that can happen is when you get a text message in the middle of the night, like, something's wrong with my skin, and it's usually the face. So that's another reason why you're here, to prevent that. And then a third reason, let's see. I keep going back to the first one. And then this girl, I really felt bad for this girl. So she went to go get a chemical peel. She was completely upset because she didn't know that her face would feel tight. It would feel hard. And so she was upset about that, which that is, an active peeling process.
Hello. So it took a lot of courage to make this video, but I felt the need to make people aware of this procedure. So I had a chemical peel done about 4 days ago. So this is day 4. And I did not do my research. I did not ask questions. I did not know, or I was not aware of how severe and serious a chemical peel can be. So this is where I'm at. And it has been very, very emotional. It has been very draining, very overwhelming. This is not for the weak, you guys. So if you're thinking of doing a chemical peel, please ask questions. Please reconsider. I did not know that my face was going to look this crazy. I cannot find another word. I've cried. I felt desperate. But I am hoping and praying that my skin goes back to normal as soon as possible. You can see how there's dark scabs, pieces of skin just falling off. It's been very painful. It's been very emotional. So yeah, guys, just please be careful with chemical peels.
So that girl, I really felt bad for her, because I feel like it was a lack of education when it came to receiving a pill. All the things that she complained about are the things that we should be talking to our clients about. That you're going to feel this tightness. It's not going to feel very comfortable. When you can't go to the gym the first 3 or 4 days. You can't go sit in a sauna. These are things that we should be opening up and talking to our clients about, because it can be more painful. And it can be, you can exacerbate the heat when it comes to a chemical peel. So some things we'll talk about is just the very basics. What is the chemical peel? The difference between the different chemical peels as far as light, dark, medium, superficial, the benefits of a chemical peel, contraindications, the best way to prep the skin to prevent adverse reactions, and what to expect during the chemical peel, okay? And then I always like to say, when it comes to clients, like, chemical peels are very popular because of social media, but everybody don't get the same results as you may see on social media. You know, hopefully they get a positive result, but everybody's not going to peel the same way. So stay tuned, because afterwards, I have a bonus for the non-professionals, and I also have a bonus for the professionals. Okay, so stay tuned to the end. So the very basis of a chemical peel. So a chemical peel is literally a chemical agent that will dissolve dead skin cells. You can do this as far as a mechanical way, and when you do that a mechanical way, that's when you do a microdermabrasion. You can do it as an enzyme peel, or you can do it as an actual chemical peel. A lot of people don't realize, but chemical peels are really an acid. That's essentially what it is. You're putting an acid on your skin and you're telling it like, hey, I don't need this layer of skin. Let's just go ahead and get rid of it. When it comes to enzymes, before I do an actual chemical peel on my clients, I always test their skin with an enzyme to see what's the resilience like with their skin. Due to the fact, especially when it comes to skin of color, a lot of people don't know that skin of color do burn easy. Although it may be resilient, it do burn a lot easier and quicker. So, you know, it's just very good to like just do the very basics and do like an enzyme peel just to see like what can this patient tolerate. This, you have to prep the skin is what you have to do. And so when you're doing these chemical peels, you're increasing the cell turnover rate, which as adults, or when we get into our late 20s and 30s, our cells start turning over at a slower rate. When we're younger, we have that smoother, that pretty like baby skin because our dead skin cells are falling off quicker. But as we get older, that don't happen. So let's go into a light, superficial, medium, and dark peels. There's different type of peels. Did you guys know that? Okay, so light peels will remove the cells from the stratum cornea of the skin. Superficial peels will remove it at the epidermis, and then the medium peels, which is more of what I do, it will remove it just at the epidermis and a little bit below to the dermis. And then you have the deep peels where you have to be literally under medical supervision for these peels. Deep peels, usually a lot of people don't really do deep peels very often nowadays. They either do the ablasive lasers or things of that nature, because if you do a deep chemical peel, patients are usually down for 14 to 21 days, and not a lot of people have that luxury to be down. So when we're talking about the layers of the skin, your skin literally has 21 layers, but these 4 categories is just, you know, the basics of these layers. So you have the very light superficial peels that would just go on top. Then you have the medium peels, and then the deep peels is when it gets down into like the blood vessel type of areas. And so those are things that you guys should be asking your clients if they ever had a chemical peel and what type of peel have they ever had. That way you'll know how resilient their skin is, or if you can, you know, go straight into a medium peel, which you have like the VI peels or the perfect dermal peels, or if you need to do something more sensitive. So let's see. I put a lot of videos in here because I like action, you guys. Okay, this video is not working. Nevertheless, moving forward, it was just going to show the penetration of different peels. Okay, let's see. So when we get into the benefits of a peel, so of course the peel is to rejuvenate the skin, cause the skin to basically peel itself and refreshen itself. But there's a whole lot of other benefits. So with peels, can you guys see me moving around these chat boxes and everything?
No.
Okay, good. Because they keep getting in my way. Okay. So the benefits of peels. So peels literally will lift the pigments out of the skin. Okay. So it will improve your texture, your barrier function, your moisture retention, increase the cellular turnover rate, which we talked about. If we do medium peels, that's when you get into reducing the fine lines, wrinkles, the surface pigmentations, giving your skin, that smoother feel. It also helps with hyperpigmentation, of course, because it lifts the pigments out of the skin. And then it also stimulates the production of elastin and collagen. A lot of people don't know, but collagen, of course, we all need collagen. We're all looking for collagen, but collagen also, it's hard to get. It's hard to get, but it can come naturally if we injure the skin, if that makes sense. Okay, so a couple contraindications. So contraindications are for people who the chemical peel is not a good treatment for them, and that's okay. You have to be able to tell your client, hey, I don't think it's time for this. And usually when I tell patients it's not time for a chemical peel, it's clients who, one, have not bought the skincare products that I've suggested. 2, the clients who I know are not going to be consistent. 3, the clients who I know are always counseling. Usually, you got those clients who will book appointment, but then they counsel, then they book another appointment, and they're not very consistent. Like, for clients to receive a chemical peel, they have to be like an active client on their program and doing a routine. It's easy for clients to go ahead and make a mistake when they do this chemical peel. For instance, if even for clients who have different lifestyles, I have a client who owns a construction company, and she's a real badass, but she wanted a chemical peel, but it just wasn't beneficial for her due to the simple fact that she's always outside, depending on her contract. She's always, like literally out in the weather doing things. And then her contracts come and go, often. So it's just really just some clients, there is just not a good idea for. Abby, do you want to talk about the contraindications?
Sure, yes. So there are several contraindications. So one, the top one is definitely being pregnant. There are some medications that you can't be on. There are some acids that you should not be on. And this, I can create a list for you guys if Brittany don't already have it, of the contraindication. But just, Brittany, you can continue talking. Just let me find that list because I wasn't sure where you would stop. Let me find the list of contraindications.
Yes. So anytime a patient is going on vacations, I always ask my clients, what events, what vacations do you have coming up? Because you're going to the Bahamas, you're going to Jamaica, then we should have did a chemical peel a month ago. If they're using benzoyl peroxide, if they have done a recent peel within the last week, if they had any recent surgeries, and even laser resurfacing, like laser hair removal, I usually can mix my laser hair removal with my chemical peels at the same treatment. But if it's laser resurfacing, that's different because that again is resurfacing the skin. Cosmetic surgeries, recent injectables, you usually have to wait about 2 weeks beforehand, because if we think about it as clinicians, chemical peels are not made to be injected into our skin. And if you have small, tiny Botox holes throughout your skin, that's essentially what you're doing. You're putting Botox underneath the skin, and it's not made to do that. I mean, sorry, not Botox, but if you're putting chemical peel on top of the Botox. Let's see, vitamin A products like retinols, Accutane, especially because that's another form of exfoliation. And a lot of people talk about exfoliation, but they don't talk about not over exfoliation, over exfoliating. And so that's the thing. Are any allergy sensitivities to the actual ingredients inside the pills?
So I'll go over a couple of things on my list as well. So for some of the contraindications, it's like aspirin or salicylic acid sensitivity, depending on which pill you're using. History of being highly allergic, like Brittany said, to anything. Pregnant or nursing. Accutane treatment within the last year, antibiotics currently being used, topical or systemic, broken skin present, laser surgery within the previous 12 weeks, application of glycolic acid products, Retin A, Renova in the previous 4 weeks. And in general, Fitzpatrick skin type 1 to 3 react well with salad. So right now, these contraindication is based towards like the salicylic acid peels, although most of them are general for all of the peels. So just be careful of that, because people will come in and then they'll, just because they want a certain treatment, they'll tell you it's okay. Like I stopped it a long time ago. Like, no, when did you stop it exactly? Send me the products that you're using, because they'll try to convince you that the stuff that they're using doesn't conflict with the treatment that you want to do. Do not do it. Even if you feel like, oh my God, they're about to drop $1,000, it's not worth your business. They're going to come back and sue you. So make sure you really, take care of these things. So some of the contraindications for like, let's say salicylic acid peels is like sun damaged skin. And like Brittany said, if they just went on vacation, the last 2 weeks or anything like that, acne, if they have like I don't know how Brittany does her peels. Like for me, like if it's a person with like really active acne, although a lot of peels can target that, I like to treat the skin first and do like a detox facial and bring them in several times before I even hit them with that peel, because I don't generally do a lot of peels. I like to use my peels for the hyperpigmentations, but I'll treat them over a period of time, and then once we get to a certain stage, then I introduce that peel. And also just make sure that it's not a new client. You want to make sure that the client's skin, because you don't want to just do your consultation and then you're like, oh, their skin look like it can handle XYZ. No, make sure you're seeing them over a period of time so that you can get to know their skin. And like Brittany said, like that enzyme, try to introduce like, a little bit at a time. I'm sorry. Try to introduce, things a little bit at a time before you really go hardcore with the chemical peel. And I know that, some of you guys here are nurses, so you can go ahead and use that VIP peel, but make sure you get the proper education. And Brittany can definitely help you with that. So that's pretty much it so far for the contraindications.
Yeah, the contraindications, you guys just have to be very like selective. Like I know pills are like so it's that season. People are asking for pills by name now. And I have clients all the time that I never met calling me like, hey, are you guys offering pills? Can I come and get a pill? Of course you can come and get a pill, but you're not going to get a pill that day, and then, the first treatment, we're going to do just a general, basic facial. The second treatment, I'm going to introduce the enzyme pill. The third treatment, we'll see how it goes, but they have to buy my skincare products.
Yeah.
Like, just because I know that my skincare products works well with this pill, there's not going to be a contraindication with it. I know exactly what you're using, and it will help increase the results that you are looking for. So that's what I like to do.
And the other thing that I didn't mention, I know Brittany has some other things on this list here, but autoimmune disease. And definitely, hyperpigmentation, hypertension, diabetes, and things like that.
Yeah, especially when it comes to diabetes. So long story short, I had a client who had diabetes. And what I learned during that process is that people who have diabetes and who have thyroid issues, hyper or hypothyroidism, their skin is a lot more sensitive than we think. And their skin exacerbates literally like everything you put on their skin. Like they will almost break out for anything because their body is over metabolizing or under metabolizing a lot of things, a lot of glucose, so.
And it doesn't heal as quickly.
It don't. So that sounds like a lot, I know. And but it's just a way to just prevent a lot of these reactions when it comes to chemical peels. The thing about it is why I think it's so important to like educate people about these procedures is because there's a lot of issues that's coming about when it comes to the med spa arena. And if there becomes more and more lawsuits, they're going to start taking these privileges away from us. And in Alabama, nurses can't own med spas. And nurses can't even do Botox or fillers in Alabama because of their legislation. Like they're going to start doing that if they start seeing these increased issues with these very basic procedures. Okay, so let's talk about skin prep. So how can we reduce these complications? So I'm trying to think of why I put this here. I had something to say. Okay. I guess I just put that there twice. Okay. Moving forward. So yes, so reducing these complications is the biggest thing when it comes to chemical peels, no matter who your client is or whatever. The best way to do it is to prepare the client's skin for a minimum of 2 weeks. And to make sure that, like I said, that they have the skincare products that you recommend that work well in conjunction to with your pill. Having a true skincare routine using professional products. I have a client who refuses to buy professional products, but she always wants these like high-end services, I guess, but she would not buy any products. And I'm just like, I at that point, I just don't trust you because I'm like, you want the results, but you don't want to work to get there type of thing. So it's like, I really don't trust you if you're not buying the products because I don't know what you're going to use at home. Like, I don't care if you do use Chanel skincare. Like, Chanel skincare may cost you $800, but it may not work good with my chemical pill. Okay.
Absolutely. Yeah. So that's one of the things on my list as well, guys. Make sure, because it's not even about you making a sale. It's about you being able to guarantee, nothing's 100% guaranteed, right? Because like Brittany said before, everyone's skin handles or react different or give different results. So just make sure, that they're going home with that home care. And like they can't even graduate from consultation without going home with that home care, because you want them, even if it's an established client, you want to make sure that they're on that protocol and stress to them how important it is for them to start using that protocol at least like 2 to 3 weeks in advance. Because, like Brittany said, like she know her product, she know what results, can achieve. And sometimes certain products are better with certain chemical peels. So you guys are going to, play around with that. But before we move forward, I just want to, kind of get a feel on you guys. Have you guys, anyone in here ever taken an advanced chemical peel class? Or is this like the first time you're really like getting into like hearing more about chemical peel? Just drop it in the comments and let me know. First class move. Okay, for Nicola, it's your first class. All right, awesome.
Yes. Well,
first class from Awesome. So guys, if this seems intense, don't worry. Like Brittany, and I'll definitely hop in and help out. Brittany's definitely gonna break it down for you, because this is something that you really need to do like step by step and go deep into it. But it's fun. Chemical peel is amazing. And the one great thing is like it gives such great results. And once you start playing around with chemical peels, some people, do the fusions and they mix it up and become a whole chemist. You'll eventually get there, but I'm glad. All right, so we have some first timers. So that's better. I feel like first timers are definitely better than someone who's already been doing it, because they're stuck in their ways.
Yes.
Yes. Okay, great.
Yes. So yeah, just making sure that we prevent those adverse reactions for our clients, because we don't want, the worst thing that could happen is your client walk out of your office, or you walk out of your provider's office, and then they're like, girl, what did you do to your skin and who did it? You know, and then they mention your name. And then your name is now associated with something negative, and you don't want that to happen. You know, of course, there may be some people who may not understand what a chemical peel is, because when I do my pills and I go out in public, people literally ask me like, oh, how did you get this injury? Or, you know, like, it's strange, but still, you don't want your name to be associated with a bad reaction. Doing advanced treatments prior to a chemical peel. So what I consider an advanced treatment would be starting off with, so my basic facial, honestly, is really the only facial that I really do. It's called my signature facial. And then that's when I would do a dermaplane, and I would do an enzyme peel on top of that. And my enzyme pills is kind of like my introduction to actual acid, so I can see how the client reacts. I like to do the dermaplane because the dermaplane just kind of allows whatever products I'm using, whatever I'm going to do to the skin, and prepares the skin to receive whatever I want it to do. So I like to do those in both, and it allows me to know how resilient my client's skin. Now, when it comes to enzyme pills, there's multiple different enzyme pills out there, but I always start off with the lowest. But if they've been on using the products for like a week or two, then I kind of advance them. You know, I have like a low, medium, deep type of category when it comes to the enzyme pills. But I always start them off low just to make sure that they can receive this. So that's my number one thing. But the most important thing is, I feel like, is at the consultation when it comes to the chemical peel. When they're asking about the chemical peel, I always ask my clients like, okay, tell me, what do you know about a chemical peel? Like, let's start at the top. And they'll say, oh, I seen it on TikTok, or I seen it on social media, and this girl's skin was so bad and now it's really nice. And I was like, okay, anything else you know about it? Did she talk about, you know, the steps she took to get it there? Because one peel don't get you to this amazing skin from bad skin. I don't even like to do one peels because I feel like you don't really get the results. Even if it's like a medical grade chemical peel, you would get the results. For instance, most people come in for hyperpigmentation reasons. You do the chemical peel, their skin peels off, that one or two areas of that has the hyperpigmentation will peel off, and they'll be happy. But that's superficially. That one or two dark marks are going to come back, and then they're going to be like, oh, but it's back again. So it's just better to do the chemical peel at least 3. And even, you know, most representatives will tell you like it's better to do the chemical peel in a set of 3 to make sure that you covering what that client want to cover, because sometimes it can be superficially gone and not really gone just because you only did one peel. And then I also put, be cautious when stacking treatments. So stacking treatments, that's what I just said I do. I do the dermaplane, I do the enzyme peel as a basic facial for my business. That's called stacking procedures. But, you know, you have to be selective because not every client can receive that. I have a client that when I started, I could not do a dermaplane on her because she had active acne. And I also could not do an enzyme because she had active acne. Like, I just had to stress the importance of literally like buying the products, being on the products. I was like, just give it 3 weeks. I know that it's going to like calm down your acne, where we will be able to actively do something to your skin. And so that's exactly what happened. We were able to do those stack treatments.
Yes, that's a great point. Because for some reason, I don't know why it's becoming a popular thing. I don't know if they're teaching differently in these advanced classes, but I've been seeing a lot of people offering dermaplaning with like majorly active acne, and I don't understand it. So guys, make sure wherever you're getting, you know, the information and education from, you know, it's a good source and it's legitimate, because we really shouldn't be offering dermaplaning with active acne, because they're not going to get the results that, you know, they can achieve. So definitely make sure, you know, you do those extractions, and like Brittany said, to calm that skin down. Bring them back after a couple of weeks. You know, it takes about 2 weeks for the skin to heal. But if they have that active acne, I would definitely say do a nice deep detox facial. And then, you know, depending on how severe it is, bring them back in for a second treatment. And if that at that point you're like, okay, your skin, it looks really good, like we can go ahead and do the dermaplaning. But if they have a lot, like 9 out of 10 times, you're not going to be able to do it after that second week either. So, you know, it's like case by case.
It is case by case. And I see a lot of things that go wrong when people are doing these stack treatments, when people are going for the dermaplane plus the micro plus the chemical peel, like all of these all at once. And that's where you make the most mistakes, I feel like. So what to expect, the do's and the don'ts, okay? And these are things that we have to like instill into our clients. Like we have to set that clear boundary at the consultation, again, while we're applying the chemical peel, and again, while before they leave. Like, this is what I expect you to do. Remember, you're not going to the gym, you're not going to the sauna, you're not going to the beach. You know, remember that, you know, you are going to peel, you are going to have this tight skin, you are going to have some redness, you are going to have all of these things, you know, but don't peel your skin, don't do this, but do this. Like, we have to set those clear boundaries, because a lot of people don't know. And let's be honest, a lot of people who are skin of color, we are just now getting introduced to the aesthetics field. I mean, we're just now getting into BBLs and et cetera, et cetera. Like, before then, this was like taboo. And now we're getting into Botox, and, you know, now we're getting into all this stuff. So a lot of things we don't know. We were just taught to wash our face with black soap and put some cocoa butter on there. And so now we're getting more advanced treatments.
Ooh, that black soap.
That was me.
Yes. You know, Rihanna broke that bridge. She's like, you know what? We like beauty too.
Right. We do. We want to
Yes.
look good, feel good. And I know, like, for years, people said, like, black don't crack, which is not true. We take a lot longer to crack, but we do crack.
Yes, absolutely. And yeah, so the do's and don'ts. There's actually hold on one second. Sorry about that, guys. So yeah, there's a do and don't list protocol, right? And it kind of go over like all the things that we discussed, but just make sure, you know, you're really religious about these things, about first-time clients and the lactating, and you know, microdermabrasion if they had anything like recently, appeal on someone who is on Retin-A. So when Brittany go further, she's definitely going to create like an extensive list for you guys. And like there's also a must-do protocol is like get appropriate training, right? Make sure that you have the appropriate license for your state, have professional liability insurance. You're probably going to have to increase your insurance. In the client consult, do a complete skin assessment and take a skin history. Get signed consent forms, very important. Make sure that they sign it before you even start anything. Perform a patch test. Do you do patch tests, Brittany, or no?
I don't.
Okay.
I was taught to do the patch test when I first started. I did do the patch test. So guys, a patch test is when you literally just take some of the chemical peel and like test it on the client's like behind the ear or a small area on the neck. But yeah, I didn't find that to be helpful.
So that's just basically testing it to see, you know, if they're allergic to it or anything like that. It's not going to test like the sensitivity because, you know, they might get itchy. Like, it's hard to determine. Like, the whole patch test is basically to find out if they have any allergies or allergic to any of the ingredients in there. Definitely don't forget to take a before and after picture. Mm-hmm. Because sometimes, well, chemical peel is a little bit more, you know, like they'll know that it's a difference. But sometimes, like, clients, they either don't pay real close attention to their skin, or they just act like they always had great skin.
Yeah, they forget what you did for their skin.
Yeah, so have them before and after and be like, oh yeah, like this is where you are. And it's helpful because if they're not a type of person who, it's the same thing like with weight loss, right? Like if you're losing weight, right, and you lose like 15 pounds, sometimes people don't notice it, but they'll look back at that before picture and they'll say, oh my God, like I really did lose weight, right, or inches, whatever. So when you show them that before picture, it'll motivate them to continue on with their home care and to continue on with the treatments in the spa as well. So just make sure and also the before and after, one of my main reasons that I do them is because for insurance purposes.
Liability, yeah.
Yes. So give client an informational sheet on treatment, give client home care instructions, because they'll forget everything as soon as they walk out the door. And that's just human, like, especially today, like so many distractions floating around. So just make sure you send them home with that instruction, because sometimes they'll forget what to do and they won't reach out to you, not because they don't want to, but because they feel like they're bothering you. Mm-hmm. So once you send them home with that sheet, and you can even do it through email, that way you know that they can just go to their phone and it's there. So just make sure you give them that, and have clients sign sheets stating that he or she has received adequate instructions and understands them. So that's also very important.
Mm-hmm. I know with my clients, I have I created like an ebook with all of my services. And so all of my services have like the basic instructions on the do's, the don'ts, just at home care reminders. So no matter what service they give, you came in for a consultation, you automatically got the ebook, and you can just always refer back to it. And then of course,
I love that.
Most peels come with the like the Aftercare instructions are an app that you can get onto or whatever, but make sure that it's always in a written form, simply because of the fact that people will forget. Like if their memories like mine, then they will forget. They forget everything you said because it can be information overload.
Right.
Mm-hmm. So let's see if this video is going to play. Okay, there it goes. Can you guys see these videos, or am I playing them for no reason? You can see them?
Yes.
Okay.
Oh, yeah.
I don't want to sign into my TikTok. I just want.
Why did I do this to my face?
Yeah, I know. I got a chemical peel 2 days ago, and my skin is falling off of my face in layers. It's so itchy. I can't stop doing this. Like, my face is so swollen. And it's so tight. I can't even move my face. It's so tight. Like, I can't move it. Oh my God. And I have to work. Like, what am I going to do? For real? Wear a mask? This is ridiculous. Like, look at it.
Okay, so basically this video is that girl like basically complaining about how tight her chemical peel is. I don't know why she didn't know that. Like, to me, her peel looked like it's going the way it's supposed to. She's having the reactions that she's supposed to. She's responding to the treatment good, but there was some kind of misinformation between her and her provider. Why she didn't know that her skin was going to peel, why she didn't know that her skin was going to be tight and inflamed and red. So that's why we just have to like double educate, triple educate, send home education. Like we just have to be a provider, like literally just educate. So this girl, let's see.
Oh, geez.
I know. Just by looking at it. Let's see. It's trying to play. So this is an absolutely do not ever do.
While I know it's really tempting to want to peel your skin off after a chemical peel, you really shouldn't, because the skin underneath is not yet ready to be exposed to the environment. When it starts to flake up like that, you can trim off the stuff that's flaking up, but don't peel everything else off. It's best to keep a thin layer of Vaseline or CeraVe ointment or Aquaphor or something over that, unless your dermatologist or plastic surgeon has given you instructions otherwise. Best to be patient and let your skin do what it wants to do.
Right. Like, don't ever peel a chemical peel. Tell your clients not to ever peel a chemical peel, because the skin underneath is not ready to be into the environmental forces that we have around us yet. That's when you get a lot of the traumatic scarring. That's when you start to get the bad reactions to the peel. And if you have skin of color, your clients have skin of color, they're 100% going to get a bad reaction afterwards. So this is another one. Let's see. This is why you have to make sure as well you choose a good provider, because this girl is actually at a provider's office getting this done. So I was reading the comments on here, and the person who videoed this was actually saying this type of peel you actually do peel off. I don't know any peel that says go ahead and peel off. I'm not discrediting this person, but I'm just saying I personally don't know any peel that tells you to peel off. That goes against everything I've learned, and it just goes against basic just education when it comes to wound care and cleaning.
Yeah, I've definitely never heard that either.
Yeah. So that's why you have to choose a provider that's, that knows well. With a skin that don't have as much melanin pigments in it, it may not do as much damage, but definitely skin of color, when you start peeling back those layers, that's when you're going to get the hyper and the hypo pigmentation. And it is so hard to treat the hyper and the hypo pigmentation from a chemical peel. So what to expect? Of course, do not peel the chemical peel. I always 100% of the time, my Aftercare. So of course my clients are already on my skincare routine. They already have those items at home, but it's more direct when it comes to chemical peels. They have a different variety. Actually, I have one up here. Aftercare. They get literally, this is just the PCA one I use. I use a variety. This is what I use for my sensitive peel. But they get a post-care kit for at home. Send your clients with at-home kits, because a lot of times it's going to come with sunscreen. It's going to come with cortisone cream, and then a gentle face wash. And so I always, no matter if it's the second, third, fourth, fifth time, whatever, they always go home with a post-peel kit. Also, I also like them because they are small. They fit into their purse. They fit, at their desk, at work. So it's very easy for them to, use on the go, especially like, the calming creams and, things of that nature. So always send your client home with a post-care kit. Is 100% all I do. Whenever you're doing a chemical peel, always make sure that you have safety mechanisms at the bedside, just in case there's a reaction. For instance, I always keep a couple things. I keep green tea at the bedside, just in case I have a reaction. I keep ice cold water. You can have baking soda, just different mechanisms that you need, because you don't want it to be a bad reaction. And then you have to run to go gather all this stuff. And then you're fumbling, and that's more time that the peel is sent on the client's face. Also make sure you talk to your clients about over exacerbating the skin. I think I put that on there. But so, and what I mean by that, like working out is going to cause extra heat to the skin. Taking hot showers is going to cause extra heat to the skin. Riding in the sun, people don't even realize how much sun hits them just because they're riding in a car. Even one day I had a chemical peel in my face, and I'm like literally like cooking in the kitchen, and I'm just like, oh my gosh, my face is getting hot because I was around heat, overly exacerbating my skin, you know. So those are things like we don't think about that can happen that can cause reactions to patients.
Yeah, like even like you tell them like don't go home and open a hot oven, like
right.
No cooking, you know, let your husband or boyfriend or your friend or whoever, let somebody cook for you tonight.
Right.
But yeah, definitely stay away from heat, workout, sauna, steam room, you know, all of that. And you know, gentle cleanser, tepid water, not like too hot, not too cold, pat dry, moisturize, SPF. And just like, you know, once you go through the process of taking like a full chemical peel class, like you'll learn like the difference between like neutralizing peels, self-neutralizing peels, and then like let's just say you're doing a chemical peel, like you have to keep in touch with them, like how's it feeling from 1 to 10, you know, and let them know honestly, like they have to tell you the truth, because sometimes they'll feel like if they tell you that it's bad, you're going to remove it or you're going to whatever. Let them know the damage that can happen if they're not being honest. Because sometimes people, you know, they don't want to tell you because they want it to just, you know.
They feel like the more tingling it is, that it's actually working. And that's not the case with chemical peels.
Right. And then like, you know, there's a difference between like frosting and blanching. So we'll go over this in like a more, you know, intensive class, but there's a lot of little details, but once you get the hang of chemical peel, like it's going to come, super easy. It's going to come like second nature, especially if you're using if you're sticking to one chemical peel, like you're going to learn it so well. And then you're going to know your client's skin anyway, you know, because they're going to be seeing you over time. So don't feel, you know, like overload right now. This is just like an overview of like all the things that you're going to need to, you know, have in your mind. And everything's going to be in the system, right? Because you're going to have your forms. You're going to know what to give to them. Home care, treatment and things like that. Everything's going to be in the system. So it's going to be 1, 2, 3.
Yeah, don't let this overwhelm you guys. I know it's a lot of information. So for best results, so I tell my clients, which I really don't like this, but if they just have to, like I have clients who like are like in the entertainment industry or like attorneys and they can't go to work with actual skin peeling. So I always invite so that's just a gif. She's just going around cutting a loose skin. That's what I tell my clients, like just you have some little scissors that are clean, you can go ahead and like just cut the skin that's hanging off, but never peel it, and make sure that they are clean scissors because you don't want to get infection or fungal infection on your new improved healing skin. So that's a way to kind of get rid of some of it. I don't never do this personally. I just let it just fall off and literally peel on its own. Let's see. I really like this girl. She's trying to get me to sign into my TikTok. So she had really good results. So I really liked her TikTok because she basically solidified what I was saying. Like, it's not just a one-time chemical peel, especially for her skin. She said she went to an esthetician and did a chemical peel every month for 3 months. And those were her before and after results. She had amazing results. I'm sure she looked like she had great at-home care because her skin was very glowy. So that's a good thing. So what to expect? I kind of broke it down into days. So the day of the treatment, the skin is going to feel very tight, moist, dewy, and then maybe a color depending on the type of pill you use. But the precautions to use is to apply the Aftercare, sustain for cardiovascular activity. So that's literally anything that will increase your heart rate, will exacerbate the heat, is what that is. The following morning, your skin is going to feel tight, dry, but it's important to stay cool. Reapply the daily care products. By day 2, that's when clients usually start to peelish. But it's important to just remind them, like, don't pick at it. Reapply the daily care and try to stay cool as much as possible. Day 2 to 5 is usually the most peeling. By day 6, usually not a lot of peeling, but your heaviest peeling is definitely going to be day 3 and day 4, and that's avoiding all direct contact with sun. If your clients have to go out in public, like they need sunglasses, a hat, a mask, like a turtleneck, whatever they need to make sure that their skin remains safe from any over exacerbating when it comes to heat, because you just want to prevent anything from happening. And a lot of times what people don't realize, like, although the clinician may not have educated the client properly, or maybe they did, but a lot of times it happens at home and the aftercare instructions. So that's why it's super important to make sure that your client is educated, make sure that you are educating your client, and make sure as a client, you're receiving all the information you need to know to be successful. It's just not an easy, simple, one and done type of thing for a lot of people. Let's see. Okay, good. We're doing good on timing. So a deeper dive. So this is where you guys can unmute. If you have questions, let's go over it. If I wasn't clear on something, let's talk about it. Or if you have a question, any question pertaining to the procedures. Or did you guys feel like that was a lot of information and you feel overwhelmed?
Mm-hmm.
Okay, don't all speak.
Are you guys? So couple things while you guys think of your questions. One of the good things to do is to make sure that your client is like in a semi-reclined position. Have a handheld fan, covers client's eyes. I usually don't, but if you feel like it's necessary, do you cover their eyes or no, Brittany? Yeah, I typically don't. Some people do. Have an eye wash handy, wear disposable surgical gloves, use sterile applicators, have all the required products laid out, have a timer, be prepared in case of a reaction. Like Brittany said, ice, cold pack, cold water, as well as anti-inflammatory and anti-itching topical products. Read protocols thoroughly, know exactly what you're going to do. When in doubt, don't do it. If you feel like, oh my God, I probably shouldn't be doing it, you probably shouldn't be.
Right.
So don't ever like doubt yourself or go against your intuition.
And if your client is a client who probably cannot follow instructions, even though they may have the money to pay, like, I just don't. I personally don't. I'm just like, this is a client that I know is going to give me a headache. Like this,
yes,
it's not going to work out good for me. It's not going to work.
Right. It's not worth the money. It is not worth the money, and you'll be able to sense that from like day one.
You will know.
Even if you feel like it's December and it's a slow month and you're not hitting your goals, don't do it.
Don't do it. And I even like, because I do chemical peels in the summer, but I do them for clients that, you know, live a certain lifestyle or can handle the instructions, can follow the directions. Like, I'm very selective on who I do chemical peels on.
Yeah. It's very important. And packages, guys, just to go over packages. And also, you know, like Brittany said, like knowing your clients and who you can do certain things for. When it comes to chemical peels, you should definitely be doing at least three package.
Yeah.
Because they can't get that result. Yeah, they'll see some type of result after the first chemical peel, but to get that deeper, like really great result that they're probably looking for anyway, they have to commit to at least 3. So they have to purchase that package up front. And you know, don't do one because let's just say they're like, oh yeah, you know, I can't afford blah blah blah. Make sure that, you know, they're ready to commit. Tell them to just come back when they're ready, because what's going to happen is they're going to come in, get that one chemical peel, and they're going to feel like, oh my God, like it really worked. It's over. Like, I don't need to go back, and they're going to cancel. So make sure they're committed to at least 3.
And then they're going to rebook the next month because that dark mark is going to come right back.
Mm-hmm. And then, yeah, so make sure they're on that home care, like regardless after that consultation. And then what else? I think we put
in the chat. Oh, the questions. Let's see. Okay. How long should I wait until after pregnancy and nursing can you get a chemical peel? So definitely, so after pregnancy, if you're not going to nurse, I would say wait until one, if you're clear from the doctor, but I really like to wait until 3 months because your skin and your hormones are so high and your skin is going to be so sensitive to whatever you do. It's going to react like you're not even going to know your new skin after you have a baby. Like you're going to have to learn your skin all over again. It's going to be like,
yeah, definitely. I agree with that. Definitely let your body do what it needs to do and let it get back to where it needs to get back to. Because sometimes what happens is people, you know, get like hyperpigmentation or like dark areas during pregnancy, and they get all like anxious about it. But most of the times those dark areas like go away over time, the hyperpigmentation. So just let them wait it out and let the body, you know, do what it needs to do.
At least 3 on the lower side. And then another question says, do either one of you use the red pill? So I don't like that pill personally because it don't fit well with my client's lifestyle. Whenever the representative came, it seemed like it's a decent pill, but you know, so the red pill, for those who don't know, it's that pill that has like, I don't know, sometimes it's orange and sometimes it's like a yellow color that they put over their face. It looks like really pasty. They leave it on for like 6 hours, I think. In some cases, I think 12 hours. And so my client's lifestyle just don't fit with it. So I don't do it. And I know there's multiple steps that come along with it. And yeah, it's really messy. So it's not something that I offer.
I don't offer that either.
Yeah. And then I feel like, yeah, just because my client's lifestyle, like a lot of people already have to schedule a pill into their life.
I don't get that.
So yeah. Let's see. I see a hand raised. How do you can unmute yourself, Destiny.
So I have a question. Because I've never done pills before. I had got 2 pills last fall. But like Revit pill, they like didn't even want to let me do pills because they said that I didn't have any experience. But then they said they were coming out with some like lighter pills that I can try for the first 3 months. What do you use?
So I use PCA pills. What I do, I call the PCA my sensitive pill, even though it's not a sensitive pill, but I use it as my sensitive pill. And then I go between DI pill and Perfect Derma pill. And so that's what I use. I don't use a red pill. I'm so surprised that they said that because you don't have experience with pills.
Yeah, and I was like, well, I'm a nurse and I have a medical director, and they didn't care about any of that. And I kind of had to double back, like, well, because I've heard some good things about that pill, but do you think that the other companies would like tell me that? Like,
yes, actually, the special guest who was supposed to be here, she's not here, but she's a representative. I can connect you with her. VI pill. No, they will teach you their protocols. That's their job.
yeah,
Like any
yes, that's what I thought.
you buy service from or you buy products from, they supposed to teach you how to use their products.
Mm-hmm.
So
I have a license, so yeah, that's how I thought that was weird. That's like when Skin Pen, I did the demo. I didn't know how to do my commission, but it wasn't hard to do. I'm a nurse, so yeah. If you could give me her contact information, because I do. I don't know if I even want to wait for them now. You know.
Right. Yeah, I will give you her contact information. They will come out. They have trainers. They have, like, I don't know. That's so strange.
Okay. That's all I want to know. Thank you.
You're welcome. But yeah, I use a different range of pills. I always start my clients like the first pill that I'm ever going to do on them is going to be my sensitive pill, and that's basically the PCA pill. Has hydroquinone on there, but I just feel like the PCA pills don't really peel our skin. Like it gives like a smaller pore size and clarity on your skin, but it don't really do like that deep layer peeling that a lot of people are looking for. And so that's why I like either the Perfect Derma peel or I like the VI peel. I use more of the Perfect Derma peel more. But a lot of people ask for the VI peel by name. So I use that too. I have a rep for both and they were willing to train me. Oh, Don, you have a rep for the Rev pill?
No, it's a rep for the VI and the Derma pill.
Oh, yeah.
Can you give me?
You.
Right. Actually, but I haven't had them come out yet.
Okay. The Perfect Derma pill, they did not. I didn't have a rep for them. Like I had an online rep, but she didn't come out and train me. But like they sent the protocols or whatever. But the Perfect Derma pill, but the VI pill will literally come to your office to train you, help you educate your clients, help your clients sign up on their app, so that they can ask questions and communicate with other people who's going through the process of the pill. Like VI pill really put a lot of money into educating, like their providers. Like I really enjoy that about them. I really do.
And can you give me an example of an enzyme pill? I heard you speak about that.
Oh yeah. Pill. So enzyme pill, like clients usually don't pill on that. So I usually just get my enzyme pills from what is it called? Skin Script. That's what I do. That's what I have up here actually. Let's see. And so it's literally like a mask, and they have different ingredients in them. Like for instance, this is a pomegranate enzyme, and it has 11% lactic acid, 2% salicylic, and it's literally like a jelly-like substance that you just put on your client's skin. It's like a mask. You leave it on for like 10 minutes. And then, and it kind of just allows me to do, I guess that's what you can call my patch test. But it kind of allows me to see how resilient the client's skin is.
Yeah.
The client is even ready to go further on this deal. I actually took a class with Joel Ellie or Joelle? I think her name is Joelle, but she was President Michelle Obama's I said President Michelle Obama, but she was the first lady esthetician. And so she did this whole class on how to do a non-pill chemical pill, because she has a lot of high-end clients, like from TV hosts to, like first ladies and people who cannot peel. Like a lot of people cannot peel. That's why I don't use the red pill, because like my clients literally have to schedule, like, okay, I'm gonna be off this day, I'm gonna take a vacation this day, let me see what days can I peel, and with red pill, you just leave that pasty stuff on for too many hours. But yeah, so I took her class, and she does this like whole big thing about non-peeling chemical peels. that will allow your client's skin to become resilient but effective when it comes to the pill. So that was a really good course that
the enzymes are definitely a nice step to, to start out, especially if it's a new client, so that you can start introducing their skin, to chemical exfoliation. Skin Script does have a lot of great enzymes. So I would definitely say, if you haven't tried Skin Script as yet, go on and take that class. They really go into depth about their ingredients and what it's good for and what Fitzpatrick is good for and things like that. But I would definitely say step out of, I don't know if anyone here is still doing physical exfoliation, like throw it in the garbage. No. But definitely start using the enzymes.
Yeah. I prefer to do an enzyme peel before I do like a microderm. But some of you guys may not even be doing microderm if you nurses. Like nurses really don't do too many microderms. But yeah, pills are literally one of my favorites because it's so easy, so quick. It takes less than an hour, and they get the results they're looking for in a short amount of time versus, repeated steps of treatments that just take a little bit longer.
Yeah, it's definitely a quick and easy service. They're in and they're out, and you're making, great money at once, and they're getting that result that they want anyway, because today people just want quick results. So chemical peels is definitely a great way to go. Definitely a good class to really take to the next level. And it's winter, not a lot of people. Brittany's like very what's the word I'm looking for? Brittany, she's very unique in the chemical peel aspect. So you're in good hands, because not many people are even training on doing summer chemical peels, right? So if you're more in like skincare, the slow months are summer. But if you're offering chemical peels during the summer, that can keep, that money up. Because let's just say you're offering a 3-package chemical peel from May to September. Like your money right there is like set for the summer. But make sure that you take the proper training, the proper class, because you want to give them the right results, and you don't want to damage their skin, because chemical peel is, it's nothing to play with. So don't go into YouTube, don't go learn on TikTok. Make sure you're getting the proper information. Like it's very in depth, but like I said, once you get the hang of it, like I have a whole folder right here from advanced classes that I've taken, and it goes, step by step into different things, different type of acids that you want to use, and pH, and so many different aspects. But once you go through the process and know like where you want to be, what company you want to use, some people dip and dabble, but once you're sticking to one company and the protocols and things like that, it becomes second nature. You still have to be alert and conscious about what you're doing, because there's still chemical peel at the end of the day, and that type of damage can definitely be permanent. So just be very careful and take the right classes with the right instructors.
Yes. So yes, please do. I hope that I was able to help someone learn something new, how to either make sure that you're getting the service that you're looking for, the results that you're looking for, or even just getting started as far as chemical peels. I think chemical peels are a great way to help the skin rejuvenate itself, and especially for people who are not doing advanced procedures, people who want to get into actual skincare. I get a lot of nurses ask me like, where should I start if I want to get into skincare? I'm like, chemical peels are so easy, you can do it, because I know like in a lot of states, nurses can do quote unquote facials, which is, but whatever. There's just regulations that the government has found to be helpful for them. And so, yeah, I feel like chemical peels is a great way to get started in skincare. So that's how I feel.
Absolutely.
So any
other? You have a question, Destiny?
No, I don't.
Oh, okay.
Okay.
Awesome.
Well, I feel
Awesome.
like this was a successful event. A lot of people could not get in. I don't know why. Like, I have like over 20 messages now in my DM. And I couldn't respond to them all, but I'm hoping I can save this replay. And then people was calling me, and so I don't know. Nevertheless, I'm gonna try to save this replay so that they can watch it. Don, did you have a question?
Yes, I asked, did I'm sorry, let me get my language together first. Do you still have to get three consecutive enzyme pills as well? Is everything done in 3?
Not everything. I only do the enzyme pills initially. Like if you call and say, hey, I would like to book a facial, that's the facial you're gonna get. But as far as like doing the actual chemical pills, I like to do that in 3 because 1, that's what the manufacturer recommend, and then 2, you are getting rid of more than just the surface pigmentation and the surface problems. You're going deeper into the skin, and so it's important to like tell our clients like the best way to keep your skin refreshed is to rejuvenate it every 28 to 30 days. And so a way of doing that is like to do the chemical pills every 28 to 30 days to make sure like you're getting the best results of what you're looking for.
Okay, thank you.
You're welcome. Christina said, do you ladies have any suggestions on where to learn and perform chemical pills? Yes, Christina, that is a good question. So I do offer a chemical pill class. And so I do offer that. I am trying to see, I did the class, I recorded it, and then I didn't record it correctly or something. But I'm gonna do another live class coming up soon. I can get you the dates, but it goes into a more deeper dive on the different type of acids, how to make the skin actually resilient to the acid that you want to perform, how to neutralize the chemical peels, if that's what you choose to do, the neutralizer. I like to use self-neutralizing, but there are peels out there that you actually have to neutralize. So it goes like into the inflammation process. It goes like deep into the actual chemical pill itself. We can get some, I'm actually working on getting some dates together for that. And so actually, Christina, is this Christina that goes to Atlanta Aesthetics University? Is it university? Atlanta Aesthetics School or Atlanta School of Aesthetics? No. Okay. Well, no worries. But I do offer a chemical pill class. I also have a whole digital library. And so, yeah, let me get some dates together. What I am going to do on Wednesdays now is like host this webinar that's going to be open to the public for pretty much everybody who wants to just come and learn information, to be just the surface information, like kind of what we did here. And so I'm going to do that like one Wednesday a month and just call it webinar Wednesdays. And so with that being said, on Thursday, the following Thursday is when I will do the actual live classes for the people who want a more deeper dive. So yeah, so DM me, Christina, so you can be at the top of my DM list. So when I do that live class, but I do have a chemical pill course available. I do offer the coaching calls, the mentorships. And then starting next year, January the 15th, I think it is, I am going to offer like spa tours where I can come to your area or come to your spa, help you with whatever skill set. It'd be a list of skill set you would choose from. Spend a day with you going over it, you and whatever model you choose to bring in. So yeah, stay on the lookout for that. So yeah, and then another question, let's see. So Don says, how much is your class? So the chemical pill class is actually, let's see. So it's actually, oh, I don't have it. Oh, I didn't activate it. So the chemical peel class, so what you would get with the chemical peel class, you would get the deeper dive into the chemical peel, but you will have homework before the class. And the homework will include the aesthetics of the skin, which is like the top skin conditions and treatments to treat, because I feel like a lot of us professionals forget actual like about skin. And so when we, and don't know really a lot about skin, like I didn't know a lot about skin until I literally went to esthetician school. So it's just like a lot of like information. I think this is like over 40 pages, the aesthetics of the skin. And so it includes that. It includes the chemical peel class and a live course. I think it was like 200. And then I can activate the link. I thought I activated it, but I guess not. But I will definitely activate that. And then that way we can do the class and everything beforehand. Let's see. Destiny, you have a question?
No, I don't.
Okay. Let's see. I can go back. What other questions do you guys have? Is that it? Okay. Well, I thank you so much for being here. Like I said, like Critically Aesthetic have so much coming up for the new year. So stay out and look out for that. But you guys know I'm always very helpful, in a DMs or whatever you guys need. I'm there available. And then Abby also, I don't know if you guys know this, but when I started my business, my first coach was Abby at Esthetician University, because I had like no way of like, I didn't know anything about nothing. And so I started off with Abby. And
yes, I'm here.
Yeah, that was like last year. And then I created like my subscription boxes, which did amazing. Abby, tell them about your subscription boxes course that you offer, because that's another it's an easy.
So one of the big things, one of the big things, no matter what you're doing, whether you're an esthetician, nurse, we all need to have like multiple streams of income when we're in this industry, because we do go through moments where, it's like slow time, downtime, whatever. So we always have to have something, like some type of income coming in at all times. So one of the things that I realized that works well for estheticians or spa professionals are the subscription boxes, because even like, let's just say for the chemical peels and things like that, you can throw them on a subscription, because depending on the size, that they should be going through it every 3 to 4 months. And if they're doing what they're supposed to be doing at home, they should be replenishing it like every 3 months or so. So once you get them on that subscription, they're committing to it. Unless they cancel it, then like they're not serious about it. And that's when you're like, if you guys are not replenishing your products, that means that you're not keeping up with your home care, and we can't move on with like the chemical peel and things like that. So the subscription box, and the holidays are coming up, so the subscription box really sells a lot around Christmas and holidays, because that's when Brittany did her boxes around like the holidays. And she started out with 25 boxes and she sold out in like 2 weeks.
Yeah, in like 2 weeks. People still ask me for the boxes. I'm just like, oh my goodness.
Yeah, because the thing is, like, now, like, people don't want to shop. People don't want to think about what to buy. So now you're going to create, and especially if you create your own products, you can throw like a bunch of stuff in the boxes. I have a class on that if you guys want to take that class. But there's like different levels of the subscription boxes, but make sure, like, even if you're going to do it on your own, do it before Black Friday, and make sure you're dropping your sales before Black Friday. Because once, Best Buy hit and Walmart hit, that's where everyone's money is going. So make sure you do your Black Friday. You can start as early as like the first week of November. And if you're going to be doing pop-up shops, make sure, you hit those pop-up shops like before Black Friday, because once Black Friday is over, people are going to be broke. Because they spend all their money on Black Friday buying big TVs, big, all these things, right? So make sure you get to them before Black Friday. And then, they're going to be buying these things anyway, because people like to buy stuff before Christmas, like around Black Friday, because they get those deals. So the other thing that I do that Brittany started talking about was coaching. So I coach spa professionals, and you know, once I started work, I love working with people like Brittany. I don't know if you guys follow me, but I know you guys see me bragging on Brittany all the time, because she, like, I knew, like, I always know when I'm gonna have a good student, like, because she, the first week, second week, she started implementing everything. And I know, like, if you guys know Brittany, if you see like the layout of this class today, she's super, and it was a free class. And think about it, she took hours to create this PowerPoint, right? She's super organized, she's super detail oriented, and I knew that Brittany would do well. And Brittany went for my subscription box class around November, sold out, and then she signed up for my 30 days boot camp. Brittany, in her first, what was it, the first week or the second week, you hit your first K?
Yeah, it was
first K,
what, the
1K day.
The second week, maybe.
Yeah. So Brittany, like everyone, so the way I structure my boot camps, like, I like to see where people are at, and I like to get to know the person and their personality. One of Brittany's biggest thing was not that she wasn't capable of doing social media. She just didn't want to do it.
And
she's like, this is too much. I can't do this. I'm not going to do it. I was like, yes, you are, Brittany. And I talked to her like, you know, I was definitely giving her a lot of extra time, because I knew she had it in her. She was just like frustrated. She was like, I don't have time for this. She's the type of person who would just hire, you know, someone to take care of it. But at that time, she was just starting out, so she couldn't really do that. So I had to stay on her to make sure she wasn't frustrated, because I know she was capable. And she pushed through, and you know, you see her now, she's doing well. She's teaching her own classes. And I love, you know, because like anything that we do, even if it's for in-person service clients, your business, their success is your business, even if it's like chemical peel, right? And one of the things that we stress upon, like when it comes to home care, it's not about making that sale. It's about making sure that they're getting the results that you know that they can get. Right. Because if they're coming to you for a year and they're not taking care of their skin at home, and they run into their friends in the streets, and their friends like, oh, aren't you still going to critically aesthetics? Right. Like, oh, well, your skin still look the same, but they're not going to tell them, oh, it's because I'm not doing what I'm supposed to do at home. Right. Because home care is 80%, just like working out, right? Working out is 20%, is what you eat, you know, at home is what's the bigger, you know, so you have to let them know that, like, you know, the home care, like you're doing your treatments, and, you know, you don't want to keep causing trauma on their skin anyway. So if they're not listening, don't even worry about the money. You just have to discharge them, because it's the integrity of your business anyway. So,
yeah. And going back to the subscription box, I use my subscription box to like bridge with the communities. Like I just got a partnership with like a facial oil surgeon. And like, awesome. In order to like introduce myself to him, or, you know, whatever, to get this partnership, I took like one of my subscription boxes, like, hey, yeah, give it to your wife, or give it to someone awesome. Their birthdays. But, you know, like basically I need this partnership. But that allowed him to notice me, you know, so.
Yeah, that's really smart. Because like, if you guys, I'm sure most of you, because you're nurses, you have worked in a medical setting. And you see these drug reps, they come in and they take care of you. All the time. They get you fat. they bring you food. They take you to dinner. They do their little presentation. They bring you gifts like every single time, right? And who do you remember the most? The rep who come in and bring you food, cookies, good stuff, whatever, every single time they come in. So that's definitely an amazing way to go about doing it, right? Because they want to stand out. They want to make sure that, you know, I'm going to take care of you, you know, when I, you know, come in here, if we're going through partnerships and things like that. And yeah, you definitely want to stand out. So that's, I like that hack, Brittany.
Yep, I did that. And actually I'm missing a meet tonight. I had a date with a machine representative, this laser. But my medical director went, and he was like, oh, well, you need to be there. I was like, no, you go, I got a class. Like, I wasn't interested in them anyway. So I'm like, they were taking us to a nice restaurant. I'm like, oh, dang. Yeah. Machine must cost a lot of money.
They hook it up. They take you to the top.
I was like, no, I got a class. I'm not going.
Yes. Well, thank you guys. I love that Carrie, like you really like stayed through the whole class. Like, do you have any questions?
She did.
I don't. You guys pretty much answered them. I can't wait to get a chemical pill. I'm currently pregnant, so I wanted to get one before, but unfortunately, life switched a different way for me.
Other plans.
Yeah, I'm definitely looking forward to getting the chemical pill afterwards. I will. It was very helpful because I wanted to know more information about chemical pills, so it was able to provide me with the information that I needed. And plus, seeing those videos on TikTok and stuff like that, you wonder why their skin looks like that, and now I see why. So definitely making sure that you get education is the most important thing. So I thank you guys for that.
Yeah,
definitely a smart move, because like sometimes on TikTok and YouTube, you don't know what's real and what's good information and bad information.
Yeah,
because they definitely had me scared.
Yeah. Congratulations on your pregnancy.
Yes.
Thank you.
You're welcome.
Okay, guys. So let's see. Last time I didn't get any content. Let's see if I can put it all in view where I can see everybody. I want to take a picture.
Okay.
I don't know if y'all cameras on. Y'all have y'all last names.
Brittany, in the beginning, I was going to say something, but I'm like, this is your class. I'm like, I always, guys, if you ever
be at work. Oh, you, Christina. Hey, girl.
If you guys ever take any of my classes, you got to turn your camera on as soon as you come in.
Turn your camera on no matter what you look like. You can be on a
tour. Hey, Hey, John, what's your Instagram? You look familiar. Wait, you're muted.
B-side hydration. I just requested both of you. Mm-hmm.
Oh, okay. All right. Awesome. Mm-hmm. I know I met Christina.
Yeah.
Hey, lady.
Melina. Hey. So are you guys ready? You guys ready to take this chemical peel class? You feel like it's something that you want to do?
I think that once you guys add this as a surface, you'll be like, why did I wait so long? It's so simple. It's so easy. You guys,
hi, Melina.
Lot happy.
Awesome. So Brittany, where can they get this class?
Yes, I actually am going to upload it. I thought I did, but I'm gonna do it right now before I leave. So if you click on a link tree, go to the what is it? The Bosses link, I think it's called.
So is there an incentive if they take action before midnight?
You know what? Let's do this. Let's do like, how much % off you guys want?
All of it.
What's a lot?
How much?
Who is that who said a lot?
No one.
You gotta rephrase. How much percentage, but not a disrespectful percentage off. I don't know if you guys know Neo. He's one of the people I recently started coaching with. And
oh gosh, yes.
He said, well, his team anyway. He always give people an option. Like if he's dropping something, he's like, how much do you want to pay for this class? And people start dropping numbers. He's like, wait, hold on. Don't give me any disrespectful numbers because I'm just gonna ignore your messages.
I was about to say 25%. Yep. 25 to 30%.
Okay, you know what? Just for you guys, I'll do 30% just for you guys.
Awesome.
I'm just to take a picture of y'all names because I'm not giving 35% to everybody.
Right.
This ain't everybody's party.
No, and you know what? You guys took a step to come to this class and you guys stayed until the end. What that tells me is that you guys are really interested in going to the next level. If a person can't sit through an informational chemical peel class, they shouldn't be moving forward into chemical peels because it's just going to get more intense, right? It's going to get more fun because you're going to start doing like the hands-on stuff. But it's a lot of information up front. But if you can't sit through an hour class, like, don't even bother. And you guys are still here, so that's amazing, and congratulations.
Yeah, an hour and 40 minutes.
Right. And listen, I scheduled out an hour, and because Brittany's my girl, when you coach with me, and if you coach with me and I like you, you can take advantage of me. But thank God Brittany don't take advantage. Brittany's always all over my page because she, she really do what she needs to do. And you guys, if you guys need any, I don't know if you guys need help with, visibility and, growth in your spot and just like attracting clientele and things like that, I can definitely help you out with that. I didn't come prepared to sell anything, but I will match whatever Brittany is doing for you guys. So you guys can just DM me the word ready, and I'll send you out a link and give you some percentage off. If you guys don't know, my page is esthetician.university. So yeah, let's do this. And what I'm gonna do is I'm gonna audit your page up front, and I'll let you know like any little like hack or tweaks that you guys should do immediately. And then we'll go from there.
I had no understanding about Instagram at all.
Now look at her. She goes live like multiple times a week.
I do. And I still hate it.
I hate
go live? I hate lives. I hate it all.
I hate it all. I think it's all a
You do so well. You do so good, Brittany.
Oh, thank you.
But you guys go live, right?
I do not. No.
Okay. All right. Well,
no?
I don't either.
I hate going live.
All right. I
hate going live too. I hate going
live.
To go live if I'm doing a procedure, like
because you don't have to like directly talk to the camera.
Right.
One hack is to just like come up with like a script on what you want to talk about. And you can go on for 5 minutes, 10 minutes, at a time until you get used to it. But that's like the biggest way for visibility, especially on Instagram, because then Instagram is going to start putting your page in front of more people, because the algorithm stuff is just crazy. And definitely start doing more reels, because I don't know if you guys noticed that Instagram don't do regular videos anymore. Now, when you go to do videos, it's automatically like a reel.
Automatically a reel.
Because they're competing with TikTok.
Mm-hmm. Yeah, my VA is always like, I need you to do more lives.
I do too. Mine is like, what do you want me to do? You haven't created a video. You haven't sent me a video.
Mm-hmm.
Get out of my messages. Leave me alone. I pay you.
Right. Like, don't give me work to do.
Right. Mm-hmm. I'm uploading this class now, so I'm gonna give y'all 30% off, and I am going to start did that, and then I will put the date, and then we'll do that. How about that?
Awesome.
Okay.
All right, guys.
I'm gonna finish uploading this, and I'm gonna get off.
Okay. Are you gonna stay on until they purchase, and then like
no, I'm gonna go ahead and let them get off.
Okay.
Okay.
You didn't put the discount live, right? You're sending them a special code.
No, I'm not gonna send them a special code. I took a picture of who can get it. No, unless someone just randomly click on it, I'm gonna leave it up until tomorrow midnight.
Okay.
Ooh. And then give you guys I know 8 or 9 until tomorrow midnight. But I'm not gonna announce it. I'm not gonna tell anybody. So that's just what it is.
So which one do we go under, Brittany?
So you're gonna go to the digital resources for bosses, and then it's gonna take you to the pay hip, and I'm about to upload the link now.
Okay.
Like 10 minutes.
Awesome.
Okay, because I see something for a chemical peel, and I see.
So that's just the book.
Okay.
So I'm gonna do. It's gonna be the book plus the aesthetics of skin plus a live thing.
Okay. All right. I'll wait for you.
Okay.
Okay. Thank you. Good night, everyone.
Good night, guys.
Bye.
And you guys, you got this.
Good night. Thank you.
Good night. Thank you.
Thank you.
Bye.
Bye.